This video shows the adjustable vacuum Terephine for DALK procedure. This Terephine had been produced by Moria with adjustable blade or lock to calculate the amount of the blade that will enter inside the cornea. As we all know, in DALK, we take about 80% of the thickness of the cornea. So if the cornea is 400 micron, we prefer to do the terephinization on 300 microns. This cornea was 500 micron thickness, so we adjusted on 350 microns depth. So it's here guaranteed not to open the anterior chamber during terephinization, which is a very crucial step to take a deep enough corneal incision to have enough thickness and enough depth to debulk the superficial layers of the cornea, the epithelium and the stroma, removing this layer and to start your big bubble technique. In this case, after debulking the superficial stroma and the epithelium, we decided to do the double bubble technique. Simply, the double bubble technique is to inject before the big bubble, small air bubble inside the anterior chamber. This air bubble will occupy the center of the cornea through a small paracentesis or small opening at the periphery of the cornea. Undermining the edge is an important step to facilitate suturing later on after putting the graft. The double bubble technique, simply injecting small air bubble inside the anterior chamber and before the big bubble will be created. To create the big bubble, simply go deep enough to half the thickness of the stroma left, and with the insulin needle directly bevel down to the depth of the cornea and inject to have the big bubble. Simply, the big bubble signs are increase in the intraocular pressure, well-defined edges at the periphery of the bubble, and the migration of the bubble to the bubble of the anterior chamber to the periphery, giving the bean-like appearance. These three signs are important to prove that the big bubble had been formed and completed to the edge of the cornea. Here, it's easy to put the viscoelastic and to do your brave slash, then create the clear, simple, safe passage or pathway for your scissors by the iris spatula. All of the time, it's advisable to work on low intraocular pressure, so now and then evacuate some of the fluid in order to decrease the pressure of the eye. Working on low intraocular pressure is preferable to protect the Descemet's membrane from being cut or perforated. Taking the 4 quadrants after having the special scissors or the blunt curved scissor to remove the 4 quadrants, taking care not to open the Descemet's membrane. As you see here, the bubble inside the anterior chamber is still in the periphery, some of it, and the rest had been came to the center of the anterior chamber. After removal of the whole stroma, now we have a clear Descemet's membrane, and here it's important to remove the edges of the cornea, and these are important in order not to create a large amount of astigmatism. This is what we call the ledge of the cornea. Removal of this ledge is important in order to decrease the astigmatism. During taking the sutures, be sure that you are in the stroma of the recipient, half stroma, in order not to perforate the anterior chamber while taking your sutures. Taking the 4 cardinal sutures first in 3-1-1 technique, and at the end of the surgery, the graft is placed in place and there is no fluid in between the interface. Thank you very much.